This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, senior attending here, and it is a pleasure to have you with us for another deep dive into the literature that is shaping our clinical practice.
And I'm Dr. Alara. Today we're looking at a fascinating new study from the journal Clinical Oncology, published in 2026. The paper is titled Efficacy and Safety Outcomes of Stereotactic Radiotherapy with CyberKnife System in Brain Metastases Patients Treated with Immunotherapy or Targeted Therapy.
This is a timely topic, Alora. In our clinic, we're seeing a shift in how we manage brain metastases, or BMs. As we know, BMs represent the most common intracranial tumors we encounter in adults with advanced solid cancers. Historically, the prognosis was quite grim, but the landscape is changing.
Exactly. The paper highlights that BMs significantly impact both morbidity and mortality. However, the emergence of systemic therapies, specifically immunotherapy, which we'll refer to as IT, and targeted therapy, or TT, has drastically improved survival outcomes for these patients. The challenge now is understanding how these potent systemic agents interact with our local interventions.
Right. We often use the CyberKnife system for stereotactic radiotherapy, or radiosurgery, SRS and SRT. But as the authors point out, the interaction of these modalities with IT and TT remains poorly explored. We are effectively entering a new era where the standard of care is becoming a moving target.
That is the core of this study's objective. The researchers aimed to evaluate three specific pillars: safety, local control, which they refer to as LC, and the overall efficacy of combining SRS or SRT with these newer systemic therapies.
Let's talk about that local control aspect. For a neurosurgeon or a radiation oncologist, LC is a primary metric. When we use the CyberKnife, we're aiming for high-precision ablation. But when you add a systemic agent that modulates the immune system or targets specific molecular pathways, the biological environment of the tumor changes.
Precisely. The study focuses on patients with advanced solid cancers who have developed brain metastases. Because these patients are living longer due to IT and TT, the durability of local control becomes even more critical. We aren't just treating a terminal event anymore. We are managing a chronic phase of advanced cancer.
And then there's the safety profile. That's always the concern when combining modalities. Does the immunotherapy sensitize the surrounding healthy brain tissue to the radiation? Does the CyberKnife to precision help mitigate the potential toxicities when these drugs are on board?
That's what the study looks at. By evaluating safety outcomes, the authors are trying to determine if the combination of CyberKnife-delivered SRS or SRT and IT or TT increases the risk of adverse events, or if it's a synergistic, well-tolerated approach.
For our residents and fellows listening, why is the CyberKnife specifically mentioned here?
The paper focuses on the CyberKnife system's role in delivering the stereotactic radiotherapy. In the context of BM patients on systemic therapy, the accuracy of the delivery is paramount to ensuring we are assessing the efficacy of the combination rather than just the limits of the radiation itself.
It's an important distinction. The interaction between these systemic modalities and our local radiotherapy is the poorly explored frontier the abstract mentions. We need to know if we should be timing these therapies differently or if they can be safely administered concurrently.
To summarize the study scope for our listeners, they are looking at patients with brain metastases from advanced solid cancers treated with the CyberKnife system who are also receiving either immunotherapy or targeted therapy. They are measuring efficacy and safety with a heavy emphasis on local control.
This is the kind of data that helps us in the tumor board meetings when we're deciding whether to hold a patient's pembrolizumab or their tyrosine kinase inhibitor while we treat their new brain lesions.
Absolutely. It moves us away from anecdotal evidence toward a more structured understanding of safety and efficacy in this specific population.
Well, that's all the time we have for this segment. A very focused look at a study that I think will be cited frequently as we refine our multidisciplinary approach to brain metastases.
Thanks for joining us. We'll keep tracking how these systemic therapies continue to integrate with neurosurgical interventions.
Until next time, I'm Dr. Aris.
And I'm Dr. Alara. This is the Neurosurgery Hub podcast.